200,000 Americans could die from the coronavirus. That is according to Dr. Anthony Fauci. Take a listen.
I mean, looking at what we're seeing now, you know, I would say between 100 and 200,000 cases, but I don't want to be held to that because it's deaths. I mean, we're going to have millions of cases.
Joining me now, Dr. Bhadelia, infectious disease physician and medical director of the Special Pathogens Unit at Boston University School of Medicine. Doctor, thank you so much for being with us.
Thank you for having me.
This morning on the Today Show, Dr. Deborah Birx echoed Dr. Fauci, saying that even if we take aggressive measures, the U.S. could see 200,000 deaths from the coronavirus. Those are just staggering numbers. Do you agree with them?
I do. You know, and there's a study at the end of last week from the Institute of Health Metrics and Evaluation at the University of Washington that a lot of people think took a pretty, positive perspective is that if we all follow the social distancing, the isolating the cases who get sick, and we test like crazy, then we might be in that number of 100,000 to 200,000. But even then, when we do that, that study basically showed that most states are going to fall short for the needs that they have for hospital beds, about 61,000 hospital beds, short of what they already have, and about 15,000 ICU beds short of what they already have, which is where this flattening the curve, this idea that we don't want everybody to get sick together comes in as we project out to looking at those cases.
President Trump said this morning that he expects the U.S. will hit its coronavirus peak in about 2 weeks. Listen to this.
Around Easter, that's going to be your spike. That's going to be the highest point, we think, and then it's going to start coming down from there. That will be a day of celebration, and we just want to do it right. So we picked the end of April, the last day, April 30th.
What do you make of that? Do you think that we will hit that peak around mid-April? Is there a way to tell?
I think that it's much more complicated than that, right? Because there's no one peak. Every state is going to hit a peak at a different time, depending on what their outbreak looks like and how much testing is being done. We do know that physical distancing works. There's a study from Northeastern and Oxford that showed that, look at China's number. When they put this into place, it does work. But it's not that we hit a peak and then everything is done. It's that we hit a peak and you have a plateau where you want fewer number of people. The acceleration of cases decreases. And given that, I think that's the message that we need to send, is that the cases will continue. It's just that we won't be accelerating if we follow all the guidance that we're sort of looking at. But all the states, everybody has to do that together.
So yesterday, President Trump extended the national social distancing guidelines to April 30th. Given what you've just said about not being really sure about the peak and just that a peak could happen in different states at different times, is that April 30th extension long enough, or do you think it might need to be later than that?
I think it's going to be a different reality for every single state. And that's why ensuring that everybody starts out at a similar place right now with the same kind of restrictions. If we could do this perfectly, the whole country go into isolation, go into quarantine, and do the social distancing and use that as a temporizing measure, right? It's not like somehow the virus will magically disappear, because what we need to do in that interim is increase our testing, fight everybody who's sick, improve our hospitals so they can handle this capacity. If we do that, we come closer to that. But I think most people think that the number is probably going to be more than just another 2 weeks. I think the reality is this may go on for a couple of months at different frequency of cases, at different acceleration of the number of new cases that we see.
We know we need to be socially distancing right now, but when we eventually do come out of this, is there a right and a wrong way to ease out of social distancing? Do you just go back to life as normal, or do you sort of need to work your way back out into the regular world?
I think it's going to be a while before we unlearn the lessons that we've learned, in this. Everybody, the whole world is holding their breath with China as it's, easing its guidance on social distancing. And they're doing it in, again, a graded manner for exactly the reasons that you talked about, because you don't want to, the minute you let down the guard, you don't want to see that spike of cases again.
Right.
But I think the lessons around, maintaining good hand hygiene and being home when we're sick are things that probably I think are going to be ingrained in our culture, I hope, for a while, because those are the measures that will help us with the coronavirus if it returns in the fall, if with a flu season that occurs next year, that happens every year, All those things I think are going to be something that we take away from this.
Yeah, it seems like it'll be a while before we get out of these good hand washing habits. I think a lot of folks are really doing that as often as possible. And it's something that we've all become very accustomed to. Let me ask you this. The FDA approved a coronavirus test that can get results in less than 15 minutes. Could that help us get a handle on this outbreak?
The FDA actually was very busy at the end of last week and over the weekend. So aside from a whole slew of emergency use authorizations, so the permission to use these tests that look promising, they also released a whole number of guidance around, how do you decontaminate the masks that healthcare workers are using, the N95s and others in the hospital setting?
Yeah.
How do we clean them in between uses? And so the test itself is promising because it's basically taking, again, the same type of samples from the person's body and running it at a higher speed at 15 minutes and doing a lot more tests together. The real test of this will be when it gets rolled out in the clinical setting to see if it has the same type of accuracy that they've seen when they're looking at it in the laboratory with clinical samples that they had in-house. And so the kind of factors that matter there are, how well are people collecting the samples? How well are laboratories able to adopt the procedures to get the sensitivity and specificity, which is the ability of the test to actually detect a disease when it exists, and then to actually detect it compared to other diseases that might be present in the person. And so a little bit to go. Cautious optimism on the test is going to make a huge difference in identifying people. But the other things that FDA has done, including the decontamination of masks, is also going to have a huge role in improving healthcare worker capacity and hospital capacity in taking care of these patients.
Yeah, you just mentioned a couple of times the new restrictions or the loosening of restrictions on sterilizing masks. What changes did the FDA make? You mentioned you think that'll be helpful?
Yeah, so a few different ones. One thing that they did was, as you know, the supply chains for respirator masks, the masks that we use in the hospital setting, in patients particularly that we might be doing procedures in which the virus may be in the room for a longer period of time, those we've run out of a lot of supplies, right? And so what they did is, one, they said, what are the manufacturers that are foreign that hit the same level of technical specifications that you could buy from? So they laid out the guidance on how hospitals and others can acquire those tests. The second is they said, you have these N95s. There are papers out there that have been around for a while, including one by Battelle, a study the company Battelle did that looked at a technology that we use in the hospital all the time to actually decontaminate other medical equipment, such as vaporized hydrogen peroxide. And so what they did was they provided an emergency use authorization to Battelle. And hopefully it's the opening of others to be able to do the same, which is using this technology to show that you can, A, remove the virus from the mask in between use, and two, the mask itself does not lose its integrity. And so it's safe for healthcare workers to keep using it. So here's the awesome thing. With this technology, you could use the same mask as long as it's not damaged during use 20 times. So you're basically increasing the supply of masks by 20 times if this procedure works.
We've been talking about the masks that medical professionals have been using. I know the advice for the average person has been not to purchase and use masks because you're taking them away from healthcare workers who need them. Your advice for people who are trying to go to the grocery store when they need to, how can they do those kinds of things and stay safe? Is there a smart way to either use gloves or hand sanitizers or wipes that can just help people, do the basic things that they absolutely have to and get back home as safely as possible?
Thanks, Alison. So important thing to sort of step back on this is, how is this disease transmitted, right? It's in the fluid that's in the cough and the sneeze of someone who's sick. And the worst way to get exposed is to be around someone and they actually cough or sneeze on you because you get the virus. And then it gets transmitted into your ears, your nose, your mouth, your eyes. And so, but the other way that people get infected is when someone's sick and they leave a little bit of the virus in the fluid that's coming from their cough and sneezing on the surface, and then you touch it. So it doesn't go through your hands. It's that you're taking your hands and then touching your face with that. And so I think a great guide to do this is good hand hygiene always works. If you're doing some work such as actually taking care of someone who's sick at home, that's when gloves are really helpful, because you might come into contact with a lot of those things that are dirty around the house. When you're outside, the biggest thing is, A, don't go outside if you're sick. If you can get help, ask others to get the things that you need, because you don't want to contribute to potentially, putting this virus out there that others may be exposed to. But the other is when you're staying away from people who might be sick in the public, the use of masks is, in the ideal setting, if used perfectly, the best use of it is when you're sick, putting it on so you don't make other people sick. But the difference is that when people use masks, I've seen them use it and they use their hands to sort of adjust their mask. And you're kind of defeating the purpose here when you're taking your hands and potentially touching your face, which is what you don't want to do. And so the big lesson here is that the first step is hand hygiene and cleaning surfaces, and then isolating when you're sick and using a mask when you're sick. If you know how to use the mask properly, potentially there could be some benefit, but really it's when you're sick that it plays the biggest role.
All right, Dr. Bhadelia, thank you so much for all of your great advice. We will try to keep up the hand hygiene, cleaning surfaces, and not touching our faces. I appreciate all the great advice.